And I think that that's a kind of a regrettable way that society is moving. That the type of argument that you're putting forward in a lot of cases and with a lot of official groups is not taken anyway seriously. This is despite the fact that out there are international studies which would indicate that people who use mobile phones regularly and are subject to these waves, that they have a 30% increased risk of brain tumours, of developing brain tumours. And the issue then about the use of mobile phones in children, we are encouraged to advise children not to use mobile phones. And that advice, I'm sure, is good, solid advice, but there's also a good reason for it, and I'm sure it gives some sort of reasoning for what you're coming forward with here this morning.
Okay, thanks very much indeed. In that case, Deputy McManus.
Just very briefly, first of all, to welcome you, and you've certainly described very distressing experiences. And really, I'd like to, you've given evidence in anecdotal form, but my question really is, has there been research carried out in Ireland, extensive research, to see the extent of the problem? The Radiological Institute have been doing what I think certainly helpful in County Wicklow, good work in relation to radon and the detection of radon gas. So maybe you could respond on that question. We're all using phones. The extent of what you describe as electrical sensitivity, I think is the term, which I hadn't heard before, but I don't know much about this. I'm not clear as to the extent of this kind of sensitivity. And maybe you may not be able to answer that question, but it would be useful if there's been any actual analysis done. And lastly, please give me your recommendations. I think it's hard to actually have questions and answers without knowing what you're recommending. Thank you.
Final stop, I'm going to ask Dr. Senator Fergal Brown, followed by Dr. Jimmy Devons.
Chairman, I was amazed during the weekend to learn that Vodafone O2 made profits of 1.4 billion. So that's a huge industry and very hard for voluntary groups to take them on and match them in spending power. And I see we've like 35 new masts a month going up around the country as well. And that obviously is causing quite a lot of concern in different communities, and we've all gone to meetings. But the big difficulty we have is that there is no scientific evidence proving that masts are bad for you. And that's the reality of it. And when you go to meetings and public meetings and people complain about a mast, that's the difficulty we all face as public reps. Unfortunately, I certainly wouldn't be surprised if a report came out in a few years' time showing problems. But as of now, there's no medical report out there which proves the harmful effects of masts. There's certainly a sector of people out there who are sensitive to electromagnetic waves. And the difficulty we have is that if for example, the masts are causing problems, what were the ESB pylons doing in the countryside for years as well? And that's a big difficulty planners face in every local authority when they're dealing with these applications. And there is an absence of information. I know that Sweden appears to be leading the way in terms of research in this area. Maybe the group might have some information from there. Just even when I saw the group coming in this week, I rang Beaumont Hospital to find out was there any link with brain tumours and mobile phones, because obviously you hear certainly lately a huge increase in the amount of brain tumours of young people. But when I looked into research, the answer I got back was there's no proven link. And that's so far, by the way. Now, that's not to say that in a few years' time another report will come out saying the opposite. But the problem in medicine is trying to prove that something caused a medical effect afterwards. Because even in the case of brain tumours, they're now linking that to viruses, and they're now linking it to maybe increased alcohol intake by young people as well. So that there's multi-factors involved in it. I was certainly surprised to see that the government are making over £1 million a year on rent from making their public buildings available to use of masts. And meanwhile, there's a committee of high-ranking civil servants putting a report together. You'd wonder, is there a conflict of evidence there or interests? Something that I discovered before was that Comreg are meant to regulate this whole area. But as far as I remember, last year, the year before, they ran out of money towards the end of the year. And what's meant to happen in theory is if somebody has a complaint or a query about a particular phone mast, they're entitled to ring Comreg, and they will go out and check the emission levels on it. Now, you often hear people complaining that afterwards, that when Comreg go out and the levels are satisfactory according to the WHO standards, but the people involved might feel that maybe that maybe the true picture hasn't been seen. But I say the frustrating part about this whole episode is that politicians unfortunately must work within the current guidelines. There are guidelines set by the WHO, and unfortunately we are being told day in day out, rightly or wrongly, that the emission levels from these